ahead of the usual start time by around an hour.
Good morning. For those of you who are paying very close attention at this very early hour, you will have noticed I am not Drew Altman, President of the Kaiser Family Foundation. I'm Matt James, Senior Vice President, and I'm pinch hitting for Drew today. He had to be in the California office preparing for the Kaiser board meeting. This is the first in a series of meetings, reporter-only meetings, that we'll be holding with healthcare reform newsmakers. Our partners in this series are Families USA and the National Federation of Independent Businesses, but you're not going to be hearing much from us, I promise. Our goal here is to give reporters access to the people who will help shape the healthcare reform debate in this country, and we have no better person to start with than Senator Max Baucus here today. Now, before we get to the Senator, let me first do a couple of housekeeping things. First, you're going to be hearing in just a few moments from Dan Danner, President and CEO of NFIB, and then from Ron Pollock, Head of Families USA. Senator Baucus will then offer his thoughts on how he thinks health care reform, how the debate will unfold, and then we'll take questions from reporters at the table and those on the phone who we have listening in around the country. As always, please identify yourself and your news organization, and please use the microphone so that we can get a full record of this. Now, this is obviously an issue of great importance to the American people. Last week, the Kaiser Family Foundation released a poll that showed that even given the serious economic problems facing the country, 62% of the public feels that it is more important than ever to take on health reform now, while only 34% say we can't afford to take on health reform at this time. Now, obviously, as we know, once the ad wars start, once the real debate begins, those numbers are going to shift. But this, I think, underscores the seriousness with which the American public is taking this debate. And I think there's no question that Senator Baucus will play a central role, if not the pivotal role, as the legislative battle unfolds. Now, with that, as I promised, short, let me turn it over to Dan and then Ron, who will introduce our guest.
Thank you very much. Let me say first how delighted we are to be here, how delighted we are to be a part of this process. There's no issue that's more important to small business than the cost and availability of health care. So we are, again, delighted to be a part of this process. We're particularly glad to be here and glad to work with Senator Baucus. We know he understands the importance of small business. We know he has a lot of small business in his state, and he cares about the impact of health care on them. So we look forward to working together. We really do want to get a solution, and we're anxious to participate. Thank you.
Hi. Good morning. You will hear from the Senator. I am
When?
I am delighted to introduce a good friend and the legislator who probably will do more to reshape the debate on health care reform as any member in the United States Congress. Senator Baucus, as you know, is the chairman of the all-powerful Senate Finance Committee. He clearly has been the leading voice in the last year for health care reform. He issued a call to action white paper in November. He conducted a summit for his colleagues in the Senate in June. He has conducted a whole host of hearings on health care reform. He has written op-eds with his colleague Ted Kennedy about the need for health care reform. He played the leading role in promoting the enactment of the Children's Health Insurance Program legislation that was adopted about a month ago. He was the leader that secured major health care provisions in the Economic Recovery Bill. And if I may tell a brief story out of school of the Senator to show his real commitment to health care reform, last week during the summit on fiscal responsibility, the Senator was assigned to the subgroup working on taxation, and he slipped out of that and he went instead to the one on health care reform. So clearly he's deeply committed to the achievement of health care reform this year. Please give a warm welcome to Senator Max Baucus.
Thank you. Thank you. Thank you, Ron, very much. Thanks, all of you. Kaiser Foundation does just terrific work. I just want to thank you. It's good to be with you here today, bright-eyed and bushy-tailed this morning, to discuss at least my top legislative priority for the year, and that's enacting comprehensive health care reform. In fact, a lot of people talk about this is one of my top priorities, so on and so forth. That's not the case here at all. This is my top priority, and it's so much a top priority. My office sometimes wonders if I'm not spending enough time on other matters. I really care about health care reform. I'm going to do all I can to make meaningful, comprehensive health reform pass this year. I want to update you a little bit on that effort so that you can follow a bit what we're doing. Clearly, the President's commitment is key, and as Ron said, we in the Congress have already done a bit to help jumpstart health care reform. I think the passage of the Children's Health Insurance Program is also another kind of down payment. There was a little bit of a debate among us just whether children's health insurance should go first and health reform second, or whether we should delay children's health insurance reauthorization because you don't otherwise expire March 31 and then fold it into health care reform. Frankly, I argued for the folding in. The President wanted an early win. He's the President, so we took children's health insurance first, and I'm glad we got that early win. There's a little wrinkle there with one provision, but we finally got it passed. And as you know, ensures health care for 11 million low-income children who otherwise would be shut out of the doctor's office. We also took important steps, Ron alluded to it, in the economic reform bill, that is investments in health information technology. I thought it's very important to get that down paymented too, partly because it's part of the stimulus bill, therefore didn't have to worry about pay-go. It just let's invest those dollars in health information technology because it's going to take a few years for that to play out. Same with comparative effectiveness research. I pushed this strongly, as have other senators. That too is in the stimulus bill. Other down payments to help us get moving. But health, IT, and sound research will also have long-term effects. We all know they'll increase the effectiveness, efficiency, and quality of health care that Americans receive. So some important goals have been met. Now it's time to move from first steps to giant steps. It's time to charge forward on comprehensive health care reform. There's never been a better moment. As I've said many times, the stars are all aligned. In addition, the President is firmly committed to reforming our health care system, more so than other presidents, although they have in many years pushed health care reform. But I don't know if any president's been as committed as President Obama. In his joint address to Congress last month, he said, quote, "The health care reform cannot wait, it must not wait, and it will not wait another year." And in his budget, he made an important and historic down payment on reform, as you know, with $634 down payment health care reform. He focused on the need to provide coverage to all Americans to contain costs and improve quality, and that's $364 billion, I think, shows a very strong commitment. We'll have to find other dollars to complete the job, but that's a very, very important, very large first step. His blueprint, I think, reflects thoughtful consideration, and it responds to calls that I have made and others have made, especially Senator Kennedy, to act now. In November of last year, I released that white paper. We had about 10 Finance Committee hearings last year. I knew last year Congress wasn't going to do very much, so I took advantage of that opportunity by convening the Finance Committee to hold 10 hearings on health care reform without any ideological bent. Just to get the facts, let's find out how these different parts of health care reform interrelate to each other, knowing that we're going to have significant, meaningful health care reform on the agenda in 2009. I'm very glad I did that because many of the Finance Committee members are much more up to speed than they otherwise would. That health care summit Ron alluded to is also important. It's one-day conference at the Library of Congress. Most of the members of the Finance Committee, other senators as well, those particularly interested in health. It started out with Chairman Ben Bernanke. Kind of highlighted, we broke out into subgroups. And then Mr. Venter, the human genome guy was there. He spoke too. It was just very, very interesting. It's again, it was we advanced the ball. I think we especially advanced the ball in a sense that virtually every member of the committee attended, and they stayed. They stayed all day long, which is remarkable if you know much about the Senate. And also at the end, we got a little discussion with a couple Republican senators. The concern was whether there should be universal coverage. And one Republican said, I don't know. I don't think that's, I don't know. What about individual responsibility? I don't know if we should have universal coverage. And some other senators, yeah, same thing. Then I asked, well, let's forget about the words. Let's forget about the terms. Let me ask the question. Do you think every American should have health insurance? Well, yeah, maybe. Maybe every American should have health insurance. And you can it's an example, in my judgment, of how just keep talking, keep working with people, and examining premises and assumptions of people, and just kind of keep talking. And not drawing lines in the sand. That we can make a little headway. So that's someone I think made a big difference among all the other hearings that we had. Consequence of all that, we wrote our paper with a call to action. And I, somewhat presumptuously, will say I think it's sort of a blueprint from which a lot of healthcare reform amendments and ideas will spring. I'm also, in that paper, as you know, recommending new avenues for individuals and businesses to access insurance, some suggested ways to make coverage affordable, subsidies to lower-income Americans, and prohibiting discrimination against those who are sick and have pre-existing conditions. I'm recommending changing incentives to reward quality of care rather than quantity. I envision a stronger health care infrastructure with more primary care physicians and a new focus on prevention and wellness. And I'm saying we must contain costs by eliminating wasteful spending and improve the value we get for our health care dollars, which will also reduce costs. The call to action, the white paper, was intended to begin that conversation, and the conversation, I think, is going great guns. I've already spoken with Governor Kathleen Sebelius, our HHS nominee. I've spoken to her twice this last week, saw her in person yesterday, and also spoke with Nancy Ann Minda-Parle. I've known her over the years anyway, and we're all anxious to get going here. Senator Kennedy and I are working very closely, so closely, in fact, that we wrote about it together in the Wall Street Journal last week. We speak regularly by phone, and we're planning to have lunch together this week. He and I convene bipartisan meetings of leaders on our respective committees and other key committees for reform. I look at it like a board of directors in health care reform. We sit down, the chairman, ranking members of finance, health, and budget committee with a couple other senators who really care about health reform. You just kind of like a board of directors, kind of overseeing kind of what we're doing. Although we're respecting committee jurisdictions, finance committee will deal with matters in its committee's jurisdiction, help its committee's jurisdiction, and correspondingly the same over in the House. Our staffs are working very closely together. They meet at least weekly. We're moving in tandem. Meanwhile, I've had dozens of individual meetings with colleagues of mine, both sides of the aisle, getting their policies, getting their plans, asking lots of questions. What do you think? What do you want to do? How do we work? I want this to be, I hate this word bipartisan, but that's what it is, as working together, both Republicans and Democrats, totally. And I started out 4, 5, 6, 7, 8 months ago, seeing senators individually, and anytime I have opportunity to speak, say, hey, look, we got a huge mess in our hands. We all know that. We got to fix it. We all know that. Everybody's got to be part of the solution. Everybody. We know that. Everything's got to be on the table. Everything. We have to suspend judgment against concepts we may otherwise ideologically or for whatever reason automatically knee-jerk against. We just keep open minds. Don't say no to anything for at least 5-10 minutes. Let's just figure out how we do all this. And I'm asked, well, Max, what about reconciliation, that process in the Senate where you need only 51 votes? Republicans asked me, aren't you going to move toward reconciliation? I said, no. That's not my first choice. It's not my second choice. I'm doing whatever I can to avoid reconciliation. I don't take it off the table totally because it's a backup. But I'd rather, by far, do this together and not have to resort to that process. Because if we have to resort, then it becomes partisan. then it's a 51-vote solution. I'd much rather have not a 60-vote solution. I'd rather have a 70-vote solution where we're getting something passed that, man, this is the right thing to do. I can tell you it's also a little bit different. I'm also meeting with the provider groups, with employers, with insurers, providers, manufacturers, labor, consumers, and taking their temperature, two-way, doing all I can to meet with anybody who's effectively part of this as I can. And clearly it's different. You know that. This time around there's much more responsiveness, much more eagerness. Business wants health care reform this year. They have to because it's costing them so much. Consumer groups clearly want it. It's costing consumers so doggone much. And governments want it. It's costing governments so doggone much. And then you hear all the horror stories of uneven quality of health care, people not getting the care they need, lack of coverage, 46 million, none, no insurance, 25 underinsured. I mean, it's just people, okay, now is the time, let's do it. And clearly the president's involvement makes a big difference. So everybody I'm talking to wants to be active. Of course, it's early. The white paper was a little bit vague, didn't have a lot of details. That was intentional, to keep people in the room. And now we're going to the next part, starting to drill down a little bit, working with CBO. It's more of an iterative process back and forth and as we score different design models, et cetera. But everyone agrees we need reform, and that we need to reform our delivery system. But to be honest, that's sort of a new concept for a lot of senators. They hadn't thought much about delivery reform before. We know about coverage, we know about cost, but delivery reform was kind of new. And that, to me, is the biggest area of opportunity. And it's going to be the driver for meaningful health care reform. Both finance and health committees we have different processes to meet with these stakeholder groups. The health committee keeps the finance committee informed. We keep them informed. And as I said, our board of directors is, I think, pretty important to kind of keep things sort of together. We meet this week, and I've called a meeting with the finance members this week also to talk about a timetable. First Democrats, then with both members, with Republicans and Democrats. It'll be an executive session just to kind of move things along here. I'm roaring forward because health care reform must happen now. If we fail to act, the problem will only get worse. The Newsmaker Foundation estimates that on our current course, at least half of American households need to spend more than 45% of their income to buy health insurance in the year 2016. Families will go under, businesses will go bankrupt, as health care costs hamstring their competitiveness. Our nation will go on struggling economically without reform. OMB Director Orzag has said it. The path to fiscal responsibility must run directly through health care. Clearly time to move. Administration is committed. Congress is ready. And I'm really ready. So let's work together to make health care reform happen. Thank you.
Great, thank you, Senator. We now can take questions from you for the Senator. Please, again, raise your hand, identify your news organization and your name, and the Senator will be happy to take your questions.
Yeah, I can't see very well. Yeah, okay. All these lights. Let's go way in the red.
Hi, this is Donna Smith with Reuters News. I just wanted a little bit more detail of what you mean by reforming the delivery system as being the driving force behind healthcare. I want to make sure I understand what you mean by that.
Well, essentially aligning payments with value. Value-based purchasing is reimbursement based more on quality, both docs and hospitals, rather than volume. It's health IT is part of it. Comparative effectiveness is part of it. Medical concept of medical home, and the bundling of payments, just focusing much more on reimbursing based on quality than our current system, which is at volume. Current system is siloed. I'm trying to avoid that a bit. Take advantage of some of the practices. In Cleveland, Mayo, Kaiser. Intermountain in Utah, it's just how we pay for what we get, and it's the delivery of health care. That's where the reform has to be. You can call
Julie.
her.
Senator Baucus, Julie Rodner from National Public Radio.
Hey, Julie.
Thank you, sorry. What we've seen already in terms of what Congress has done on health care with the Children's Health Insurance Program and the health provisions in the stimulus have come with significant pushback from the Republicans, to wit, some of the changes you made in the Children's Health Bill about legal immigrants, and even the significant fight over the comparative effectiveness research money. We're seeing Republicans already claiming, talking about rationing and government takeover of health care. The Republicans seem at the moment in no mood to compromise when it comes to health care. How are you going to bring Republicans along when, as we've seen in this Congress already, they seem to be in not much of a mood to come to the middle on this issue?
Well, bottom line, there is a real deep desire among many Republicans to find a solution. At the end of the stimulus debate after the vote, Senator Grassley on the floor said, don't interpret this to mean that Republicans don't want to work on health care reform, the next major issue. And I went over and shook his hand, thanked him for that. Second, the other areas you mentioned, children's health and comparative effectiveness, are really kind of outliers in the sense that there is a lot of agreement. Don't forget, children's health insurance passed by a very large margin, and that is increasing the scope of coverage by a very large margin in '07 twice, by large margins, although vetoed twice by President Bush. And the version we took up this year was, frankly, it's the same, but I say it's outlier because it would have been very, very bipartisan, but for the addition of the legal children 5-year delay repeal. And they saw that as bad faith, because I thought we were just going to focus on children's health insurance, although certain legal kids are part of health insurance. And so that's sort of a special case. And on comparative effectiveness, somebody started this rumor that unfounded, some bloggers and some right-wing radio, that this is this is going to focus on cost. This is rationing health care, just a bunch of hooey, frankly. Once we got that straightened out, then it wasn't a problem. But just bottom line right now, you just feel it. Republicans, most of them want to. They're gingerly looking at it, but they do want reform.
Yes. I think I got this on. Senator Wyatt Andrews at CBS. Thanks for doing this, first of all. A couple of finance questions. If everything is on the table, do you see going after the deductibility of health care in any way to help finance it? Second question on medical home. I realize it's early, but conceptually, if you want to pay these primary care docs more, it's kind of easy to see how you might do that through CMS, but how do you do that through the employer-provided insurance system?
Well, it's true that we have an employer-based system in America today. Without getting into how it originated, back in under Nixon wage price controls, whatever it was. That's just forget about how we got here. That's where we are, and it's Americans are used to it. It does have problems, and it was also an issue during the presidential campaign, where Senator McCain said, basically get rid of it, and focus on individuals' ability to get their own health insurance, and President Obama during the campaign said, no, keep employer-based, but some other changes. I think that that tax provision should be on the table because it currently it's too aggressive. It skews the system. Without saying that, I do not favor eliminating it. Some senators earlier in some legislation basically do want to eliminate that tax provision, the deductibility to the company and non-income to the employee. That's not where I am, and I don't think that's where the vast majority of the Congress is either. But I do think it needs to be trimmed, limited, looked at. A, it skews the system, it's regressive, and B, it's a source of revenue.
Second part of the question, please, how you pay for medical home?
Don't know. We'll get there. My thought is we're going to kind of focus a little first on delivery generally. That's certainly be part of delivery. Then coverage. Then we got to get to how we're going to pay for all this. It's just again, it's scoring with CBO, and frankly, this is a whole new area too. CBO does not have near as much data on a lot of these design issues as they do traditionally in other areas where members of Congress have introduced bills and amendments and so forth. It's an open field in many areas, just not a lot of data. It's hard for CBO to score. Now, that's a blessing, it's a curse. It's both. It's a double-edged sword. And I've had several conversations with Doug Ellendorf about this, and also with Peter Orszag, who clearly knows a lot about scoring healthcare, and is the president's budget point person, wants to make this work too. So we just have to work our way through all this and how we score, not just medical home concept, but lots of other concepts. We're just not there yet.
Great. Yes, right here.
Anna Edney with Congress Daily. Senator Baucus, last week you mentioned that there were some concerns with President Obama's proposal to limit itemized tax deductions. What are those concerns, and do you feel that it's a realistic offset, or is there something else that you see getting that same amount of money from?
Well, I think it's a very good faith proposal, putting $634 billion on the table as a down payment. It's very, very important, and I'm very heartened that he did. And I had many discussions with the administration, even during transition, saying, hey, if you really care about health care reform, you got to speak about it strongly in the budget, and you got to, strongly in the President's statement to the joint session of Congress, and also in the budget, and they did very strongly. Look, you got to start somewhere, and that provision, that 28% limitation, is interesting. I am committed to health care reform. I'm committed to find ways to make sure we cut costs. It's very efficient. We're not wasting money. I'm committed to find the revenue that's needed in the early years, looking for savings in the out years. And I'll be taking the temperature of senators to see which measures are either have the path of least resistance or which measures are more popular. There's lots of ways to deal with this. That one you mentioned is just one, and so we'll see. I cannot answer that question yet because it's just too early.
Yes.
Thank you. Laura Meckler with the Wall Street Journal. I have two questions. One is, when you do introduce legislation, do you intend for it to be a bipartisan bill with Senator Grassley or some other Republican? And secondly, I know that you're meeting with the committee later this week to talk about timing, but could you give us your personal general sense of what you're hoping for? Are you hoping, for instance, for committee or Senate action this spring, or do you think it'll probably be pushed into the summer or fall?
I don't hold me to this, but I think a bill, joint bill, will be good. Clearly, the stronger preference is a bill with Senator Grassley on it, and I've been talking with him. Our staff's been talking. We meet weekly anyway, going over issues. Have for many years. Our staffs meet weekly. We're very close. There are other Republican senators who also care deeply about health care reform, on and off the committee. They'll be strong allies. And it's an ambitious goal, but I'd like to have us ready for the floor by June or July, before the August recess. I'd say June. It's good to give ourselves a little bit of make it early rather than late.
Joanne.
I'm Joanne Cannon. I edit the health policy blog at the New America Foundation, among other things. You used the phrase "advancing the ball," and you know clearly the president's budget and the entire your white paper and the entire conversation is a very comprehensive cost quality coverage conversation, and probably more than many people anticipated just a couple of months ago. So, what wakes you up in the middle of the night in a cold sweat? What's the thing that you really worry about going wrong since we failed at this for 60, 70 years so far?
You think I'll answer that question?
Yeah.
Well, I guess this might add new definition, the meaning of masochism. But I know I've never attempted anything as challenging. This is the most difficult legislative challenge in my, life. And I relish it. This is so much fun. I don't think I'm naive at all of the problems that are out there. It is so complicated. And one big problem, frankly, is education. Is educating members of Congress and the public about all these different parts and how they fit together, and basically helping people understand that not only the need for reform, but how to reform. People know there's a problem. They're paying too much. Some families are going bankrupt. I mean, it's awful that some individuals and families are going through. They know there's a problem. They know their premiums are way too high. They can't get insurance, or their insurance is dropped. They know the problem. They're just quite not sure what the solution is. And so, because it's so complicated, members of Congress really haven't thought this through very much until the last year, I dare say. And so it's a major problem is just helping people understand how these parts related, how these pieces can be fit together to essentially achieve reform, and so that their bills will start to be more tolerable, so that there will be more coverage, so that budgets aren't strained quite as much. And also, it's just a real effort is to keep this bipartisan, and talk to groups and to senators who may be inclined to drift away and get them back on the program by explaining that, hey, that worry you have, maybe that's not that much of a worry after all. And we're aware of that concern. And so that's a legitimate concern. And we're dealing with it. Now, there certainly will come times when you just have to say, sorry, I can't do that. But again, the assumption here is find a way to get to yes, that accomplishes our objectives.
Right here, and then we'll come back to you.
I'm Jim Byrne with Community Health Funding Report. You made an impressive case here about the tremendous effort you put into education and conversation with your colleagues in the Senate. Have you had any outreach to the House side to find out where the leaders there are?
Yeah, I have. And I regret that it's not probably as much as it should be. I spent some time with Chairman Waxman, with Chairman Rangel, not as much with Chairman Miller, but we've been talking, and we meet. Henry Waxman, I set up this process where we meet bi-monthly, and I learned this, frankly, years ago when I walked up to Senator Grassley and said, Chuck, I got an idea. I said, let's just, you and I meet weekly. Your office, my office, didn't make any difference. Lock it in, and to minimize misunderstandings and get to know each other better and so forth. And we've been doing that for about 8 years, and it works wonderfully. It's almost the point now, if you were a fly on the wall, you'd think it's one office. It just, we're working together pragmatically try to solve problems. And there's no acrimony, those bitternesses are there. I've done the same now with, I've instituted the same process with Chairman Rangel. And that works weekly. And that works very, very well. And since that works well, and also the same with my Montana colleague, John Tester, we've decided, okay, let's do it with Henry. And it'll probably expand. And monthly, I meet with Charlie and Rangel and I get together with the ranking member, this time it's Dave Camp, and also with Chuck Grassley, so the four of us get to talk about issues. It does work. I mean, it does work. I'm not saying it's perfect, but it works. It's certainly well worth the effort, and so I'm going to try to expand the effort with the House.
Emily Walker with MedPage Today. Senator, you were talking about comparative effectiveness earlier, but in the stimulus bill, the provision in there said that it's not going to be linked to payment policies at this time. So how do you foresee comparative effectiveness actually adding value to the system? Is it just that physicians will read this research and know what's most effective and change their practices that way?
Basically. You can only take, the key is to take as big a step as possible without being, I remember Russell Long once saying, if you lead a parade, you can't get too out far in front. You can't leave people behind you. You got to be still there, part of the process. There were some suggested adding costs, so it's kind of a cost-benefit analysis. That frightened too many people. So at this point, I said, hey, wait, let's do the analysis and make it public so that consumers, providers have that information. They then can go compare costs themselves. But initially, that's not the thought. It's going to take steps at a time and significant steps at a time. But I think that step works best at this point.
Rakesh, we have a question in the back there.
Yeah, Karen Tumulty from Time Magazine. What about, I mean, the concept that are in a number of plans, including yours, would allow people to buy into a Medicare program or a Medicare-like program. Where, you say nothing's off the table. I mean, where does single payer fit into all of this?
I think single pay is, America's not ready for single pay. I mean, America. We are a bit different than peoples in other countries. We're not Europe, we're not Canada, we're America. It's go west, young man. It's entrepreneurism, it's creativity, it's innovation, and so forth. And I think we have to come up with a uniquely American solution, which is a combination of public and private, because we're America. I think that we'd be spending capital inefficiently by trying to pursue a single pay system when we have another pathway to meaningful health care reform available to us. I'm for, I think there should be a little choice, some flexibility in our reform package. And I think this country is not ready, does not want single pay. I mean, this is not a single pay country. Some suggest it, but I don't think it's there. I think we can make better use of our time trying to enact meaningful, comprehensive reform, basically along the lines in the white paper, which is very similar to what President Obama is suggesting, and it's somewhat similar to the Massachusetts plan. And that's I think it's a better use of our time.
We promised the Senator we'd have him out of here in a couple of minutes. I have a couple more questions. Robert, did you have a question?
Robert Payer, New York Times. When you said, Senator, that you thought the tax exclusion should be examined and perhaps limited, the tax exclusion for health benefits for employees, do you think that might lead to a tax increase for people with more generous health benefits? And do you have any ideas about how the revenue might be used then?
Well, money's fungible. So any revenue can be used basically anywhere in this context. At least I don't like to align one source of revenue with this provision in healthcare reform. And as I mentioned earlier, we're only beginning to try to figure out, which revenue provisions, work here and which don't. I've got, talked to our members of my committee, both sides, what works, what doesn't work here. We got to put these models together. lots of discussion, interminable discussion with OMB and scoring. And it just, I can't answer that question. The second part of your question, at this point, I just don't know. It's just too early.
Alexis Seminary with National Journal. Can I just follow on that? You mentioned we were talking about the 634, the reserve fund.
Right.
To what extent do you think the president wanted that to be a lure for members to come into the room? To what extent do you think
Lure?
a lure to get them in, to put money on the table? Do you think it's a deterrent? And you mentioned that there's going to be a need for additional sums to do reform. What's the tipping point, do you think, in terms of your feel of members, in terms of the dollar amount that will be needed and what they won't accept if they focus on cost?
Well, I don't know where that tipping point is yet, because we haven't put, I don't want to get too far ahead of myself. I have a schedule in mind for the first half of this year, which I'm going to talk to members about this week. And I don't want to get into that right now, because I don't want to get ahead of my team here. But and then when we do, we'll have a better idea of where that tipping point is. It depends, obviously, on how effective the other provisions seem to be working, and scores we can get in some of these, and savings we can get in some of these. I just don't know yet. In answer to, I think, this lady's question over here, that's one area I'm just, I sleep pretty well at nights, actually. but that's one area I think about a lot, many times a day. Questions like that. It's design and scoring and fitting pieces together. It's too early to answer that question yet, where that tipping point is. We'll find it later.
Well, despite the fact that your staff is hovering, you have time for one or two more questions, Senator. So, yes, right here.
Hi, Senator. Grant Huang with Part B News. I know you talked earlier about getting a bill before the August recession.
How about recess?
Recess, right. You can see what's on my mind. But I wanted to ask about the physician reimbursement. Right now, there's a 21% cut that's mandated to take effect in 2010
Right.
under the SGR formula.
Right.
So I'm wondering, will the comprehensive reform efforts happen soon enough to avert the cut? And if not, will there be another patch, as there has been in the past?
Well, I was pleased to see the administration talking about addressing the SGR, that is in a comprehensive way. I'm having conversations with OMB about administrative actions they can take to help solve that. Otherwise, it's a $300 billion item over 10 years. That's pretty big. And I've got ideas of actions that can be taken to reform the payment provision, and also in a way to cut down the cost to Congress anyway, significantly limit that $300 billion. We're working on that. And the good news is that we have an administration. Senator Obama was our president, working with us on health care reform, working with us in the Congress. We're on the same page, basically. It's just finding ways to make it work. You know, it's a huge opportunity we have, and those are a couple of the stars that are aligned. It's not always been the case, but it is the case today, and we'll find a way to mutually address that. And the administration wants to help us. They say they want to help us, and I believe they want to help us.
All right, last question. Rakesh, somebody in the back row here?
Yeah, hi. I'm Lester Fader with The Nation. I'm curious, we talked about before where you mentioned that we need to come up with additional money to finish the job on top of the $634 billion. Are you personally committed to finding the rest of that money in this round? How much money are we talking about to finish the job? And if not this round, how are you going to decide which Americans will be helped by this down payment and how many, to extend the metaphor, are going to have to wait for Congress to figure out if it can afford the mortgage?
Well, first of all, you know, we're paying for it. This is not the stimulus which was not paid for. This is all paid for. And the next installment will also be under the pay-go rules. We're going to pay for it. It's not going to add to the deficit. Will not add to the deficit. It'll be paid for. Second, I'm not looking at this in a way of saying, well, the first X amount is going to help Y amount of people. Next, you know, A amount of dollars is going to help the remaining B amount of people. That's not the way this works. This is going to be phased in over time. You can't do it all. The implementation can't all be at once. It's going to take a couple, 3 years to get this phased in, frankly. And that's going to be work, too, because even after we enact by legislation certain provisions that maybe don't take effect till year 2 or 3, then the doggone thing has to be implemented by CMS, et cetera. And that's just going to take time. Also means we're going to have to beef up CMS. CMS is going to have to be ready to roll here. But the money's going to be paid for, and it's just going to be phased in where it'll just be phased in over time, and it's just not going to be a category of people. It's going to be cut out at first and then included later. It's going to be phased in, so everybody. My goal is everybody's working together on this, so we're probably the same.
To follow up, so are you saying though that there will be a plan in this initial round that shows how you get to universal coverage, or are people going to be left wondering after this goes through, if you're only funding it to that amount, whether Congress will actually come up with the money to do this?
My goal is to have a plan that covers it all.
Great. Thank you, Senator. I really appreciate you being here today. For all the reporters at the table and those on the phone, very sorry we weren't able to get to all of your questions. I'd like to thank Dan from NFIB and Ron from Families USA for joining us here today also and helping us to sponsor this. Our goal is to do these meetings every other week, hopefully on Tuesdays, so we'll be back in touch with you soon with the next in our series on health reform newsmakers. Thank you, Senator.
Thank you. Thanks, everybody.